Hi there, Dr. Abdul El-Sayed here. I'm a physician, epidemiologist, progressive activist, and co-author of the new book, Medicare for All, A Citizen's Guide. I want to talk today about why Medicare for All would help to address the shameful health inequities that we have in our country and is critical to addressing anti-Blackness and taking on structural racism in America. Well, first, I want to start with a startling fact. We are in the midst of a pandemic, and that pandemic has taken 2 to 3 times as many Black lives, depending upon what state or city that you're in, as it has white lives per capita. And that fact should astound us. But here's the thing. If you've been watching anything relative to health inequities in our country, you know that this is nowhere near new. Think about any healthcare issue that we could talk about. Infant mortality, death at the beginning of life, 2 to 3 times as likely among Black babies versus white babies. Think maternal mortality, 2 to 3 times as likely. Think asthma exacerbations. Think diabetes hospitalizations. All of them far more likely among Black Americans versus white Americans. And I want to talk a little bit about why this is. Let's focus in on the COVID example here for a second. We've got a virus, and we know that that virus causes a particular pathology in humans. But it's not just about the virus. It's about the way that the virus interacts with a particular host in a particular environment. And what we've got in America right now is a virus that has been tackling hosts who have been beaten up on by the environment. When we think about structural racism and the ways that it shapes our lives, it influences where one grows up, who one's parents are, the probability that one's parents have been justice involved. Think about the water that people drink. Think about the air that people breathe. Think about the housing that they live in. Think about the jobs that they work. All of them systematically shaped by structural racism. And so this environment, this structurally racist environment, has been beating up on Black and brown people in our country for a very long time. It's the reason why the baseline risk of underlying conditions, things like hypertension and high cholesterol and obesity and diabetes, are substantially higher in Black and brown Americans than they are in white Americans. And then in comes the virus, and it walks a path just like these other diseases so that it affects Black and brown people more. They're more likely to get it and more likely to die of it. Now, when we think about the role of healthcare, I want us to differentiate between healthcare and health. Health is a function of illness, but healthcare is supposed to be that set of institutions that prevents illness and treats illness once we have it. And unfortunately, healthcare is also just as inequitable, if not more inequitable, than the circumstances of disease that we're talking about. So rather than be a salve for the systematic increase in the likelihood of illness as a function of structural racism in the environment, in fact, it helps to perpetuate it. And that starts with the insurance industry. Think about the fact that if you don't have public insurance, whether it's Medicare for seniors or Medicaid for low-income folks, that you're likely to be insured if you have it through an employer, which means that if you're less likely to work in a job that provides health insurance, or you're unemployed, you're less likely to be insured. And in this circumstance, when we know that race affects the schools that people go to, the jobs that people work, the income that they make, of course, if we rely on the employment sector to provide health insurance, that it's going to be less common among Black and brown folks. And lo and behold, we know that Black folks in America and brown folks in America are far more likely to be or underinsured. They're more likely to have to pay a high out-of-pocket cost if they get care, and they're more likely to be on Medicaid. Now, Medicaid is a program that is supposed to address that fact. But here's the thing. We know that programs that are tiered, that specifically are created to provide services for poor folks, are a recipe for poor programs. Medicaid does not reimburse health providers the same way that private insurance does. And so what tends to happen is in low-income communities, particularly Black and brown communities, you have hospitals that are disproportionately reimbursed on Medicaid, which means that over time, the lack of money that they get because of that high proportion of Medicaid patients tends to leave them without the resources that they need. And so we know that Black folks, even in the same cities, are more likely to go to hospitals that are under-resourced and where outcomes are worse. And so it's not just about health insurance, it's the way that health insurance patterns access to healthcare itself. I mean, this is a problem in rural communities too. We know that rural community hospitals are being hollowed out because a high proportion of those patients are Medicaid patients. And because of the low density of people, you just don't have enough money flowing into those healthcare institutions and they shut down. Think about the hospital in the community where I used to be health commissioner, the Detroit Medical Center. It started out, Detroit Receiving started out as a public hospital. And over time, it became a nonprofit hospital, and now it is a for-profit hospital. They got in trouble 4 years ago because they could not wash their surgical instruments correctly. They weren't autoclaving those instruments, and they were causing the infections. And it's the way that our private health insurance system that is relegated to only those who have income patterns the resource flow into hospitals that then patterns the kind of healthcare that people get or don't get. So it's not just that Black and brown people are less likely to be insured or more likely to be underinsured. It's also that the hospitals that they attend, as a function of that uninsurance and as a function of that requirement of having to be on Medicaid, those hospitals tend to be under-resourced as well. And then there's the treatment that people get in hospitals, whether it's conscious or unconscious discrimination. We know that that is a serious issue. Part of that is the fact that we have fewer Black and brown doctors in the healthcare system. And that is a function of the way that structural racism shapes in educational opportunities and debt burdens. We, in fact, authored a paper called The Color of Debt, where we looked at the differences in the debt burden of Black medical students versus white medical students and found that they had significantly higher debts. And those debts become a paywall that then keeps too many promising Black and brown students away from medical school. So we have to address that. But then there's also the way that bias is pernicious in the ways that institutions treat Black patients. And the stories are profound as they are sad. Now, how do we address that? Well, Medicare for All could help to address that too. So I want to talk now about Medicare for All, why it is a key to this solution. Number one, Medicare for All would provide health insurance to every single American. That means that no longer would we see these disparities in health insurance access that are so critical. And second, it would be the same health insurance. The reimbursement that comes with paying for healthcare for your body, whether you are Black or brown or white in America, will be the exact same, which means that the process by which lack of health insurance and Medicaid then leave hospitals and clinics that disproportionately serve Black and brown people under-resourced, that goes away because the reimbursement that comes with your insurance in Medicare for All is exactly the same, which means that you now have resource flows into hospitals that treat predominantly Black and brown communities in the same way that you have resource flows into hospitals that don't. And then when it comes to thinking about medical school, well, we know that Medicare right now actually pays for physician training after medical school. Why is it that Medicare under Medicare for All couldn't pay for all of medical school? In fact, if we were to do that, it would take away the barriers that too many promising Black and brown students face to getting into medical school, and we could increase the diversity of the physician pool to help to address that issue of bias in the clinic. We know that patients, Black and brown patients who see physicians of color tend to do better over time. And then lastly, it's possible that reimbursement rates could change based on whether or not a certain hospital is treating enough Black and brown patients relative to the local community, or how their outcomes fare relative to white patients. And you could imagine, right, that under Medicare for All, because you have one payer into the system, that you could toggle those reimbursement rates based on how well these hospitals perform. So you create an incentive to address any systematic bias that is either keeping Black and brown patients out or leaving them to be treated worse than white patients. And so Medicare for All can help to address the systematic differences in insurance access, systematic differences in hospital resources, and both conscious and unconscious bias, because it allows us to focus in and treat every single body the same way. Now, I want to finish on a final note. Truth of the matter is, the hospital industry, the pharmaceutical industry, the insurance industry, they are fighting tooth and nail to defeat Medicare for All. And they're systematically trying to alter the facts on the ground. But here's the thing. I want to remind you a little bit about our history. Medicare itself, the program for people over 65, you know what tactics the AMA and others used to try and oppose Medicare? They fearmongered, played to racism, because they told, in particular, folks in the South, white folks in the South, that if Medicare passed, it would desegregate hospitals. And those folks fought tooth and nail to oppose the passage of Medicare. We know what happened there. Medicare passed, and in fact, hospitals were desegregated. It was a critical moment for healthcare in our country, a critical blow to anti-Blackness. But here's the thing. The same forces are trying to fearmonger. They're trying to tell us that if we passed Medicare for all, that the system would take away choice, that the system would cost too much, and that people who are hanging on by a thread onto their services would lose those services. In fact, I've heard folks say, well, if Medicare for all passed, I'd lose my Medicaid. Well, you get a fantastic upgrade in what Medicaid offers if, in fact, we had universal public health insurance for everybody, which is what Medicare for all would offer. And so we've got to step up against the forces of moneyed interests in healthcare to take on that fear mongering that tells folks that somehow the system would get worse if we guaranteed every single person, no matter the color of their skin, access to high quality government health insurance, just like everyone else. We've got the opportunity to do that work. I hope that you'll check out the book that I wrote with my co-author, Dr. Micah Johnson, Medicare for All, A Citizen's Guide. We talk a bit about these issues and so many others in the book. I hope you'll check it out, medicareforallbook.com. You can also access it at the conference website just here. So I really appreciate the opportunity to talk about the role that Medicare for All would play in taking on systemic racism in healthcare and addressing health inequities in our country. I believe deeply that this is what we need to do, and I hope that you'll consider checking out the book and continue fighting for Medicare for All. Thank you.